Dr. Murthy, it's great to be with you. Look, I've tried in our conversations this morning to kind of move forward a little bit on the question of where we stand as a nation on mental health. Are we reaching people that we have not traditionally reached? Are there new methods of getting there? I know that this is very, very important to you, and I'd just love to kind of get, if you were to give the State of the Union yourself on mental health in America, where are we?
Well, I'm so glad you raised it, Steve. You and I have spoken about this subject before in years past, and I was deeply concerned about where we were as a country regarding our mental health before the pandemic began. But my concerns have only grown since then, in part because we're seeing rising levels of anxiety and depression across the population during this pandemic, and that was compounding rates that were high before then. There are some places where we've made progress and some areas I think where we have work to do. In terms of progress, I do think we are talking more about mental health as a country. I think more people are sharing what they're going through. That is extraordinarily important because the stigma around mental health really prevents people from stepping forward to get help. The other place where I think we have made progress is in actually funding mental health services. And we've certainly funded even more recently SAMHSA, the Substance Abuse and Mental Health Services Administration, with additional funds to provide more community-based mental health services. All of that is good. But here's where my concerns are. My concerns are that we are still not doing enough to meet the extraordinary demand that we have. And what we have to do is, number one, continue to work to the best of our ability to expand access to services. And that means not only mental health care in an independent clinic, but integrated into primary care. We also have to make sure that we are training more mental health providers. And we've got to invest on the prevention side as well, Steve. We have programs that we know work to help reduce depression and anxiety, to help reduce the incidence of a whole host of other conditions like substance use disorders. And these are cost-effective programs that can be implemented in schools, yet we're not investing in those. So I think we have a lot that we can do. And my hope is that we will use this opportunity during COVID, when a spotlight really has been shined on mental health, to really talk more about it, to reduce some of that stigma and to invest in prevention and treatment.